Sperm. We usually associate it with one thing, making babies. But what if I told you that sperm's journey inside the female body is far more complex and surprising than we often think? It's true. Beyond its reproductive role, sperm has a fascinating array of effects, influencing everything from a woman's mood to her immune system. This isn't some fringe theory. Scientists have been studying these effects for years, uncovering a complex interplay between sperm and the female body. Some of these effects are beneficial, offering potential health perks. Others come with risks that are important to understand. This isn't just about biology, it's about relationships too. The presence of sperm, or the lack thereof, can subtly influence the dynamics between partners. It's a fascinating area of research that challenges our assumptions and sheds light on the intricate dance between the sexes. So, buckle up. We're about to delve into the surprising world of sperm and its multifaceted effects on the female body. Get ready to be amazed, maybe a little squeamish, but ultimately, far more informed about this tiny cell with an outsized impact. Let's start with the good news. Research suggests that exposure to semen may have some surprising benefits for women. One area of interest is mood. Studies have shown a correlation between semen exposure and improved mood in women. This isn't just about the sex itself either. Some studies suggest that even without intercourse, exposure to semen can have a positive impact on mood. How does this work? Semen contains a cocktail of mood-regulating compounds including endorphins, oxytocin, and serotonin. These chemicals, when absorbed into the bloodstream, can have a direct impact on the brain, promoting feelings of happiness, relaxation, and well-being. But that's not all. Semen may also play a role in boosting the female immune system. Studies have shown that women who have regular unprotected sex tend to have stronger immune responses. This is likely due to the presence of certain proteins in semen that can stimulate the production of antibodies. So, there you have it. Semen, beyond its role in reproduction, may also act as a natural mood booster and immune system enhancer. It's a reminder that the human body is a complex and interconnected system, with even the seemingly simplest of acts having far-reaching consequences. Before we get too carried away with the potential benefits of sperm, it's crucial to address the potential downsides. Like any bodily fluid, semen can carry infections. Sexually transmitted infections, or STIs, are a serious concern, and unprotected sex can increase the risk of transmission. But it's not just about STIs. Semen can also trigger allergic reactions in some women. Semen allergy, while rare, is a real condition that can cause a range of symptoms, from mild irritation to severe anaphylaxis. It's important for women to be aware of these risks and to practice safe sex by using barrier methods like condoms. Another potential downside is the risk of bacterial vaginosis, or BV. BV is an imbalance of bacteria in the vagina, and while it's not always caused by semen, it can be a contributing factor. This is because semen is alkaline, while the vagina is naturally acidic. Regular exposure to semen can disrupt the vaginal pH balance, making it more susceptible to BV and other infections. The key takeaway here is balance. While semen may offer certain benefits, it's essential to be aware of the potential risks and to take steps to protect your health. Open communication with your partner, regular STI testing, and the use of barrier methods are crucial for safe and healthy sexual experiences. Let's delve a bit deeper into the topic of vaginal pH. The vagina is a finely tuned ecosystem with a naturally acidic environment that helps to keep harmful bacteria in check. This acidity is maintained by lactobacilli, beneficial bacteria that produce lactic acid. Semen, as we mentioned earlier, is alkaline. This means that when semen enters the vagina, it temporarily disrupts the delicate pH balance. For most women, this isn't a major issue. The vagina is remarkably resilient and can usually restore its natural pH fairly quickly. However, frequent exposure to semen can make it more challenging for the vagina to maintain its optimal pH. This can create an environment that is more hospitable to harmful bacteria, increasing the risk of infections like BV. So, what's the solution? It's not about avoiding semen altogether. Instead, it's about being mindful of the potential impact on vaginal pH and taking steps to maintain a healthy balance. This might involve using condoms during certain times of the month, especially after menstruation when the vagina is naturally less acidic. It's also important to be aware of the signs of vaginal infections, such as unusual discharge, itching, or odor, and to seek medical advice if needed. Beyond the physical effects, sperm also plays a fascinating role in shaping the dynamics of intimacy and bonding within relationships. Research suggests that exposure to semen may influence a woman's emotional connection with her partner. This is where things get really interesting. Remember those mood-boosting chemicals we talked about earlier? Well, they don't just affect mood, they also play a crucial role in social bonding. Oxytocin, often dubbed the cuddle hormone, is released during intimate moments and promotes feelings of trust, connection, and attachment. Some studies suggest that women in relationships where condoms are not used tend to report higher levels of relationship satisfaction and emotional closeness. While correlation doesn't equal causation, it hints at the complex interplay between sperm, hormones, and relationship dynamics. Of course, it's not as simple as saying that semen is some magical love potion. Relationships are complex, and numerous factors contribute to intimacy and bonding. However, the research on sperm's influence in this area provides a fascinating glimpse into the intricate ways in which our bodies and our relationships are intertwined. Section 6. A deeper look at the science. Unveiling the mechanisms behind the effects. We've explored the various effects of sperm on the female body, but how exactly do these effects come about? What's the science behind it all? Let's dive a bit deeper into the mechanisms at play. One key player is the immune system. Semen contains a variety of proteins and antigens that the female immune system recognizes as foreign. This triggers an immune response, leading to the production of antibodies. While this response is generally mild, it can have a priming effect on the immune system, making it more efficient at fighting off future infections. Another important factor is the hormonal changes triggered by semen exposure. Semen contains hormones like prostaglandins, which can influence ovulation and the menstrual cycle. It also contains relaxin, a hormone that helps to soften the cervix and prepare the uterus for pregnancy. Furthermore, the absorption of seminal fluid through the vaginal walls allows for the direct entry of various compounds into the bloodstream. This includes those mood-regulating neurochemicals we discussed earlier, which can have a direct impact on the brain and influence a woman's emotional state. The science behind sperm's effects on the female body is complex and multifaceted. Researchers are still unraveling the intricate mechanisms involved, but what's clear is that sperm is far more than just a reproductive cell. It's a complex cocktail of chemicals and compounds that can have a profound impact on a woman's physical and emotional well-being. Section 7. Individual variability. Why sperm affects women differently? It's important to note that the effects of sperm on the female body can vary significantly from woman to woman. Just like with any other biological process, individual responses can differ based on a range of factors. One factor is a woman's own hormonal profile. Hormone levels fluctuate throughout the menstrual cycle, and these fluctuations can influence how a woman's body responds to semen exposure. For example, a woman may be more susceptible to the mood-boosting effects of semen during certain phases of her cycle. Another factor is the composition of a man's semen. Sperm count, motility, and the concentration of various compounds can vary widely between men. This means that the effects of semen exposure can differ depending on the individual man. Furthermore, a woman's overall health and immune status can also play a role. A woman with a compromised immune system may be more susceptible to infections even with limited semen exposure. On the other hand, a woman with a robust immune system may experience more pronounced immune-boosting effects. The key takeaway here is that there's no one-size-fits-all answer when it comes to the effects of sperm on the female body. Every woman is unique, and her individual response to semen exposure will be influenced by a complex interplay of factors. Section 8. Responsible choices. Weighing the benefits and risks. We've covered a lot of ground exploring both the potential benefits and risks associated with sperm exposure. So, how do we make sense of it all? How do we make responsible choices about our sexual health and relationships? The first step is open and honest communication with your partner. Discuss your concerns, your comfort levels, and your sexual health history. This includes being upfront about any history of STIs or allergies. Next, educate yourself about the risks of STIs and the importance of regular testing. Condoms remain the most effective way to prevent STI transmission, so use them consistently and correctly. If you're concerned about the potential impact of semen on your vaginal pH, talk to your doctor. They can help you assess your individual risk factors and recommend strategies for maintaining a healthy vaginal environment. Remember, knowledge is power. The more you understand about the effects of sperm on your body, the better equipped you'll be to make informed decisions about your sexual health and well-being. Section 9. The future of sperm research. Unraveling more mysteries. The study of sperm and its effects on the female body is an ongoing journey of discovery. As scientists delve deeper into this fascinating area of research, we can expect to uncover even more surprises and insights. One promising area of research is the potential therapeutic applications of seminal fluid. Scientists are exploring the use of seminal fluid components in treating conditions like preeclampsia and preterm labor. Another area of interest is the role of the vaginal microbiome in mediating the effects of sperm. The vaginal microbiome is a complex community of bacteria that plays a crucial role in vaginal health. Understanding how sperm interacts with this microbiome could lead to new strategies for preventing and treating vaginal infections. The future of sperm research is bright, and the discoveries made in this field have the potential to revolutionize our understanding of reproductive health, immunity, and even the dynamics of human relationships. So, stay tuned. The journey has just begun.